Recreational use and subsequent addiction to opiates can be dated back to Islamic societies in the 14th century. The father of modern medicine, Hippocrates, was the first to use it in a clinical setting to treat nausea. The first warnings of the possible consequences of the product came from an unknown contemporary of Hippocrates, Diagoras of Melos. Diagoras noted that many of his fellow Greeks became addicted to the drug. His warnings were ignored. Opium addicts were created. In 1803, there was an important advance in the world of analgesic medicine. German chemist Friedrich Serturner had purified opium's most active and abundant ingredient, morphium, named after the Greek god of dreams, Morpheus, due to its tendency to cause sleep. Whilst conducting studies attempting to separate pain relief from addiction, Serturner himself became addicted to the drug. Much like Diagoras of Melos, he warned against its use. Once again, the advice was ignored, and in 1827, German pharmaceutical company Merck began to mass-produce morphium. Morphine addicts were created. In another series of unfortunate events, Heinrich Dresser found the notes of aldorite a few years after his death. Aldorite had tested an acetylated form of morphine on his dog in 1874. The dog overdosed but survived. However, the study was ignored. Until Heinrich Dresser found that diacetylmorphine entered the brain 5 times more efficiently than morphine, it was reasoned that diacetylmorphine was less addictive than morphine, and the German pharmaceutical company Bayer commercialized it as a substitute for morphine, hence the name heroin, as it was named after its heroic properties. In fact, they even promoted it for use in children with coughs and colds. Heroin addicts were created. The problem was again worsened by the introduction of the pharmaceutical painkiller OxyContin. In a series of scheming and biased advertisement campaigns by the pharmaceutical company Purdue, OxyContin was released and excessively prescribed by doctors without considering potential patient abuse. This was due to the claimed time-released preparation of OxyContin tablets. Unfortunately, this was easily bypassed by users, as it was found that crushing and sniffing, or chewing the tablet, allowed as much as 160 milligrams of OxyContin at one time, potentially a lethal dose. If you look below the video, you'll see an article which talks about the Purdue campaign for OxyContin. This has created a climate in which 259 million prescriptions were written for opioids in 2012. This is more than enough to give every American adult their own bottle of pills. This has had a massive impact on society, as 4 in 5 new heroin users started out misusing prescription painkillers. In fact, in 2014, a survey of people in treatment for opioid addiction found that 94% of respondents said they chose to use heroin because prescription opioids were far more expensive and harder to obtain. In 2015, there were 2.6 million people aged 12 or older with a substance abuse disorder involving prescription pain relievers or heroin. This has led to an unfortunate death toll. In 2015, there were 52,404 lethal drug overdoses, with 20,101 related to prescription pain relievers and 12,990 related to heroin. Overall, it is clear that opiates are very useful in terms of providing relief from pain. It gives us a chance to ease the pain experienced by those in circumstances such as end-stage cancer. However, from the early days of Hippocrates to the modern days of Purdue's financial greed, this powerful substance has been mistreated by our society. This resource aims to inform you about the perception of pain, how opiates can provide relief from it, but also how they can be abused.